All right, hey everybody there.
Hey guys, this is Graham,
This is Ashkahn.
and today's question is, what do I need to know about floaters undergoing cancer treatments? And how might they affect my water for other customers?
Okay.
I'll just leave this one to you, I think.
Yeah, I got this. So in my years
Ashkann's
of
the one
medical
here that
school,
actually has a medical degree, so
so I mean, I guess I don't know.
we're not doctors.
There's a big I don't know here.
We're not doctors. We never graduated medical school.
So let's talk about. I feel like the second part of the question.
How to reach out to people who are doctors?
Yeah, 911 I think is what you call, and then.
So first of all, if you're getting this question from someone who has cancer and is being treated for it, there are a lot of different ways the cancer can be treated, and your first course of action should definitely be to have them ask their physician or the people who are treating them.
Yeah, you're also not a doctor.
I mean, probably, right? Some of you may be.
That's
yeah.
true. I feel like the second part of their question was alluding to maybe some sort of concept of chemotherapy, like whatever is going on in someone's body, leaching out into the float tank, or potentially being harmful for.
Yeah, causing issues somehow with what you're leaving behind in the water.
Yeah, and I don't know. I'd be a little surprised if something like that was going on. We don't tend to leach things out like that, I think. It's this idea of detoxifying or having toxins coming out of your body, even, regardless of chemotherapy or anything like that, I think is not the most credible thing I've heard in my life.
Yeah, for sure. You can do some quick Google searches on the idea of kind of detoxing things out of your body in general, and find some fun reading there for sure.
Yeah. So I would probably, just my hunch, again, of not really having any idea about any of this. My hunch is that there's probably not really a huge concern there. I don't imagine that someone is leaving something in the float tank that would affect anybody else.
Yeah, and their doctors will know as well. And I would assume that a lot of the stuff that is going into, because you do find things like medications and stuff like that in pools and hot tubs, but it's a lot of people urinating it out. It's not
right.
Usually sweating.
Or sweat.
Yeah, or sweat. Yeah, I was gonna say.
But again, you don't really sweat as much in float tanks.
That's also what I was gonna say. Yeah, so
there's
there's kind of less concern of both of those happening. I mean, and just like anyone who's just taking painkillers could do the same thing. If they're peeing it all in your float tank or something, then they're leaving behind some trace amounts of opioids and things like that in the water too. Whether or not that's actually harmful to people or just gets completely inactivated over the filtration process, is a question.
But no one asked that question. So
so we don't have to answer
that.
But related to cancer specifically, and so I just went out and did a quick Google search, was kind of what I did to assess what's going on. According to the American Cancer Society, at least, concerns about going into swimming pools, hot tubs. I didn't see anything about concern for other swimmers or other people in those hot tubs. It was in the case of hot tubs, it was that someone might get dizzier than usual because they're going through chemotherapy and should be, in a hot tub around someone else so they don't just kind of pass out or drown or something like that. And that was one of the biggest concerns out there. In the case of being in a swimming pool, it's kind of don't overexert yourself. Make sure that you're confident in the cleanliness of the swimming pool you're going in. So, as a float center owner, paying special attention to how you're treating the water and making sure that everything is up to snuff is really necessary to have anyone in there who has sensitive disorders. You can imagine someone getting really sick or catching a stomach bug when they're going through chemo just sounds like the worst,
Yeah, and hopefully that's just true. You should just always be doing a good job with your sanitation, hopefully. But
yeah, I guess that's
probably one. If anything were to happen, that would probably be the most likely, is someone's just gonna get sick, and it's especially sucky because they have something else going on, or they have a system that is not as strong to kind of deal with it.
Yep. But that was it. So the American Cancer Society didn't seem to have any concerns. I'd be less concerned about anything being left behind than someone potentially, getting lightheaded or having any nausea or something in the float tank. But
yeah, definitely nausea can come with chemotherapy, and sometimes people can get nauseous in float tanks.
Yeah.
Hopefully, this probably wouldn't, I would imagine, be super related, but it's in an area that if you have like motion sickness or things we talked about on other episodes, that is something that could lead to like a heightened state of nausea.
And we've had many people with cancer come through Float On and have some really nice heartwarming stories from their time in the shop too. So at least from their perspective, it truly does seem to help at least a certain population suffering from cancer.
Yeah.
I'm not helping in the sense of like cure their
It cures
cancer,
it.
but
It cures float tanks cure cancer, I think is what we're trying to say here.
but definitely helps with the relief and just the perception of pain and their ability to kind of have a good day to day.
So, I mean, other than that, it'd be like just other normal medical concerns. I mean, certain people have, maybe specific medical equipment they're dealing with or things going on with their body that you're going to have to, again, probably reference them to their doctor rather than just taking wild swings at answering them yourselves like we're doing. And, and yeah, I mean, really just play it safe. And at the end of the day, hopefully, if everything's kind of set up and their doctor's okay with it and all that sort of stuff is good, then it should be great. Like you should be helping them out.
And if you have other medical questions for us, for Dr. Grashcom over here, go to floatanksolutions.com/medical questions, and we will answer those for you.
All right. Yeah, that's it. That's the website. So we'll talk to you guys tomorrow.
Bye, everyone.